Earlier this week, the MasterCard Foundation announced a partnership with the Africa Centers for Disease Control and Prevention, where $1.3 billion will be deployed over the next 3 years as part of a new initiative to acquire and deliver vaccines across the continent. Ms. Reeta Roy, the president and CEO of MasterCard Foundation, spoke to us about, among other things, the nature of this partnership and that it's based on 4 elements. Take a look.
And it covers 4 areas. First is to acquire vaccines for at least 50 million people. Second, it is to support the rollout and the deployment of vaccinations to millions more across the continent. Third, it's to lay the groundwork by developing the human capital, the human workforce for vaccine manufacturing on the continent. And fourth, it's to strengthen the Africa CDC, as well as to enable it to oversee this significant initiative. So the beneficiaries are the African people. That's number one. And we need to mention that equity and inclusion are really critical anchors of this partnership. And so as we start to work with different countries to understand where they are with their vaccination plans, that's how the rollout will begin. And as you may have seen, WHO, the Africa CDC, and different ministries across the continent have prioritized segments. So first and foremost, healthcare workers. Second, people who are elderly or people with particular underlying health conditions. But the goal here is to vaccinate as many people as possible so we get as close as we can to the target that's been set by the African Union, and that is to vaccinate at least 60% of the population of the continent by 2022.
And how soon will we start seeing the results of this project?
Well, work is already underway. Next week, we begin regional consultations with ministries of health to understand the status, both in terms of their vaccine supply, what they have purchased, what they may have already planned through bilateral relationships, as well as where they are with their actual vaccination rollout. What are their needs? Is it for more training of healthcare workers? Is it to stand up vaccination centers? Is it around pharmacovigilance to understand adverse effects for those, in rare cases, to get the real sense of what those needs are? Vaccines under this initiative are destined to arrive in the early part of August and then progressively in increasing amounts.
And as you said that the goal is 50 million Africans to be vaccinated in the next 3 years, but for a continent that's over 1 billion people, one could say that it's a low target. Is it lack of resources, or what's your thoughts on this?
So the goal is not 50 million people. The goal is for the African Union's goal, which is to vaccinate at least 60% of the population. That is close to in the neighborhood of 750 million people. So let me situate this for our listeners. When we began this initiative, we really wanted to understand what was coming to the continent. And as you may know, there is a facility known as COVAX, which is a global facility, which is providing vaccines to many countries around the world. And there is also an initiative led by the African Union. It's called the African Vaccination Acquisition Task Team, or the shorthand is AVAT. So between COVAX and AVAT, the continent is expecting to have sufficient supply for anywhere between 50 to 55% of the need. So there's still a gap to be filled. And our purchase is trying to help get closer towards that target of 60% vaccination. I hope that's clear.
Yeah, definitely. And are there any measures or conditions that the MasterCard Foundation has in place to ensure perhaps efficiency and effectiveness of this initiative?
Absolutely. First and foremost, we have put into place a steering committee between the Foundation and the Africa CDC. We will be involving numerous implementing partners who are part of this initiative. The good news is we're not starting from scratch. We are not creating parallel systems to ministries of health. What we're doing is getting behind the work which is already underway in multiple countries through ministries of health. So we want to coordinate with them, we want to expand and to augment and even accelerate their efforts.
We've known, Reeta, we've known education and hospitality to be the main key areas that the MasterCard Foundation works with. Is the decision to invest in healthcare a long-term project, and what are your future plans?
You've rightly said, the MasterCard Foundation was set up in 2006 to do two things. One is to advance education, and the second was financial services for the poor. And more recently, we have developed a strategy known as Young Africa Works, which is to drive opportunity for young people in parts of the economy in their country, which is growing, parts of the economy which require skilled workforce. And in Rwanda, health and hospitality is a major area. But in light of this pandemic, we will also be looking at other areas. And the healthcare sector, if you look at it just through an economic lens, has huge potential. And it is also a sector which can offer numerous opportunities in terms of occupations as well as careers for young people. So that's a very critical sector we'll be looking at going forward.
Well, thank you so much, Ms. Reeta Roy. It's been a real pleasure to speak to you, and thank you for your insights.
Thank you very much for this opportunity.